Jane St. John. And if that pops up on your screen, just click got it, and we'll just keep on going. We are recording the session. So I'm Jane St. John. I'm with the Charting the LifeCourse Nexus, and I will let the other panelists introduce themselves when they come up. I am a parent, as well as working on the Nexus team here. My son Ben is going to be 32 years old on Saturday. I don't even know how that happened, but so if you've ever watched anything about Charting the LifeCourse, you've probably seen examples of Ben. So we share our lived experience around the world, really. Okay. So I'm just going to get us grounded here real quick before we get into the meat of the presentation on the LifeCourse principle of the person in the context of family and community. If you were in the opening session this morning, you heard a lot of talk about the trajectory and the star, and those are very important principles. But the person in the context of their family and the importance of family and why the family is so important is what we're really going to dig into during this session. We're going to talk about, excuse me, I'll change my notes here. We're going to talk about family caregivers a lot. We're going to talk about how can we better support them in their roles as family caregivers. We also want to support families to think about their own good life, right? They always think about the good life for the person they're supporting in their life, but we also want them to think about a good life as a family member and as a family unit. And so it's important to support people in that way as well. We also want to support families to have a voice in things like person-centered planning, because families have a lot of important information to share. And then finally, we want family caregivers to be able to take a break, to be able to relieve some of that stress, to be able to just do things for themselves for just a little while even, or just to do nothing sometimes. And so that's the rest of our panelists are going to talk a lot about respite and how they're using Charting the LifeCourse respite tools to help families be able to do that. So to start us off, we know that all people exist within the context of a family. And families are defined in LifeCourse very broadly. Families are however the person and the family define it. It may be people that you're biologically related to. It may be people that you have no biological connection to. So foster families and adoptive families and people that you just consider to be family. And families are all different sizes and shapes and arrangements. And family is family is family. We don't care what it looks like, the size of the family, the makeup of the family, whatever people say is family is family. And we know that the needs of the family and the person adjust and change as different members of the family change. And so maybe a family member goes off to college, and that can change the outlook of how the rest of the family's support needs look. So we also know that people with IDD in particular, and that's not the only thing we'll be talking about today, when we're talking about people with developmental disabilities, if you look at this chart far on the right in the green, you see that only 11% of people that we know of with developmental disabilities out of the 4.7 million estimated people with DD in the United States, only 11% or about 500,000 get out of home services. There's another 12% in the middle in the purple, about 672,000 that receive services but still live at home. And so again, they're living at home. And so the family and the family caregiver has a big role in their lives, continuing well into adulthood. I mentioned my son, Ben, earlier, who's almost 32. He still lives at home. And so my husband and I still have large caregiving roles when it comes to Ben's life and helping him be successful and have a good life. And then we have 75% of those 4.7 million people that aren't known to the service system. And so we don't know a lot about them, but we can safely assume that many of those people, adults especially, may still live with family and have family caregivers. And so it's really important to talk about and think about and always consider the family anytime we're planning and making policy and talking about different practices. We always need to think about the family because they play such an important role in the lives of people with DD. We also, this slide's a busy slide because it's a compilation of several different things, and I'm not going to go into detail about any of them, but we know that family has a lifelong impact on a person, biologically, their environment, their social connections, and kind of the family, we call it family policy, but the family rules and the family expectations and the dreams and the aspirations of the family, all of those things can continue into adulthood. That family impact lasts forever. My parents have been gone for a number of years, and I'm not a young person anymore, but I still feel the impact of my parents and my family growing up. We talk about the individual life stages in the bottom right here, and how we, when a person is young, their family provides all their caregiving, right? They're a baby, they need help and they need support with every single thing. As they get older, they can do more things for themselves. They go off to school, they eventually become an adult. And in a typical person's life that doesn't have a disability or hasn't even acquired a disability, maybe because of aging, that family may not have as large of a role. But when it comes to a person with a disability or someone who's aging, who's maybe being taken care of by a child or by their spouse or by another family caregiver, that changes again for them to need more and more support because of their disability, or continuing support because of their disability. The other thing that we talk about is what we call reciprocal roles. And I'm going to talk about that a little bit more in just a second. But we talk about roles around caring for a person, which is more of the caregiving type of role, and the caring about, which is the love, affection, spending time, making memories, knowing all the things about that person. And those are equally important, but sometimes we get so caught up in the caring for that we forget to plan ahead for being able to have time for the caring about, and not just caring about that one person, but the entire family and the other members of the family as well. And so caring for and caring about should be treated as equally important. In LifeCourse, we want to be able to support all the people around that person and around that family. And so we want to support the person in their self-determination and their advocacy for what they want and what they need. We also want to make sure that we're supporting families across the lifespan. And so those family caregivers across that lifespan, what do they need? How can we help them to have a voice? How can we help them to have their good life as well as in their caregiving role? How do we support them? And then far over to the right in that green section, how do we support people in the person-centered planning process? So I want to talk a little bit about some Charting the LifeCourse tools. I'm going to talk more about what we call the family perspective tools, which are very closely related to the respite tools that you'll hear about in later on in this presentation. By the way, this is my family all over the place here. So if you haven't ever seen my family before, if you look at the picture up on the top left of your screen, Ben is the one wearing the reindeer hat and the red hat and the reindeer sweatshirt. So that's my son, Ben, and that's his twin brother in the plaid shirt as well. His older brother, Zach, is in a number of the other pictures. And so, I have 3 boys and then my husband and I. And then if you look at the middle picture, this one really represents the broad consideration of family. Let me look in chat here. Somebody says, can you please turn on captions? Hang on one second. Let me do that real quick. I apologize. Roy, do you have control with the captions? Because I'm not seeing it.
No, but I will, let me work on that.
Okay, yeah. There's usually something at the bottom that says turn on captions. And I apologize. Roy will work on that. Thank you for bringing that to our attention. This is being recorded as well. So anything that isn't captioned as we go through, we will caption later on. You can go back and watch it again if you would like to. So again, let's talk about the family perspective tools here real quick. So the reason we really talked about, or the reason we developed what we call our family perspective set of tools is because if you're a person with a disability or a person who's aging that needs support, we want to make absolutely sure that your voice is always heard, right? So we want to make sure that we don't take away that person's voice from the family contribution. And so we want to keep those things distinct, not necessarily separate, but distinct. And so these tools are designed to really help the family have a voice. As we said earlier, so many times families play a big role in a person's life throughout their lifespan. And so they often have a lot of information. My son, Ben, although he's able to speak for himself, sometimes the only thing he'll speak about is what interests him that day. So he only may want to talk to you about NASCAR or wrestling or some music artist that he really likes. And that's great. But if you're planning with him, that's not going to give you a lot of information you need to really start to get to know him around his needs and his support and what his good life looks like, other than the one thing that he's talking about that day. And so as a family that lives with him and has lived with him for 32 years, we have information that might be needed by someone who's planning with him or getting to know him. And so how do we share that information without taking away Ben's voice? He can say whatever he wants for his part of the planning process or whatever, he's doing, but you also sometimes need to listen to the family and listen to the information that they have and to talk about what their needs are as well in that caregiving role. And so this is the family perspective trajectory. It looks a lot like any other trajectory if you're familiar with our tools, but this one is specific to what is my vision for my, for my family member's good life. And then what are the things that I don't want for my family member? Looking back at the past experiences, this is where families can be really helpful. What are things that have helped go towards a good life for that person in the past? And what are things that have maybe gotten in the way? And then moving forward, what are things that we would like to see? In my case, what would I like to see Ben working on? What are things that are important to him that we would like to bring forth? Because, with living with him and with listening to him over days and days and months, you understand then what's important to him. But again, if you're just talking to him for that one day, you may not get all that information. So this is an example of our family perspective trajectory for Ben. And again, you can put, as a family member, you can put anything you want in there. So I think a lot about, I'm getting older, my husband's getting older, we both have health issues. What's going to happen to Ben down the road? So I want to leave that little bit of a roadmap about what I think is important that people should know. And so my vision for my family member includes things like, always having a good relationship with his other family members, to keep doing the things that he likes to do, like his volunteering and going to church, and that I really want him to be okay and to thrive even after we're gone. The things I don't want, like poor health or being alone on holidays or a birthday, those are the kind of things that keep me up at night and that I worry about. And then looking at his past experiences, some of the great things that happened in his life, and then some of the things that maybe we thought were great at the time, but it's like, that turned out not to be a great thing. And those are important learning experiences that it's important to share with other people. And then this is what we call our family perspective life domain vision tool. And this is really breaking down that life course vision that we talked about on the trajectory into smaller parts. So what do I see Ben doing as a job, or maybe having his own business in the future? I'm going to show you Ben's example right now. Where do I see him living at some point? The pandemic has slowed us down a little bit on that kind of planning, but we know that at some point Ben needs to be living probably separately from us. And how do we make that happen? All the things that he does socially and enjoys and so forth on down the line. So this is just another example of how you can really get that family perspective and learn a lot of information from the family. And then I want to come back to the caring for and caring about. And again, the caring about is really the love and affection and time together and all those kind of things, which is so important. But sometimes as caregivers, that gets lost. And so the part that I circled here is really when we talk about family caregivers, right? So taking care of those daily needs, those everyday things that need to happen. And that's a lot of times where families need support. So what kind of support do they need? How can we help them verbalize that? How can we get that support for them? Another tool that I just wanted to show you really quick is the mapping relationships tool. This is a way really to delve into who are the people in that person's life now that care about and care for that person. And then looking ahead, who else might be able to do that? Who else could be in that role? And that's a great way to help families not just plan for the future, but if you're doing everything right now, who else can do one little thing so that you can maybe take a break? Okay, so you've probably seen this before if you're familiar with LifeCourse at all. So we talk about the good life for all. So we want the person to be self-determined and interdependent and productive. be integrated and be part of community life in all ways and be included. We also want to make sure that families are supported in ways that maximize and bring to the top of the thing their capacity, their strengths, their abilities to take care of that person and to love that person and support that person to be able to do all the things we just said we wanted for them. So I took the liberty of kind of changing this into respite to kind of take us to the next part of our presentation. So when we think about the person who's receiving care or being cared for, we want that person to have greater independence and be able to maybe spend some time away from their caregiver. Nobody likes to be with the same person all day, every day, all the time. So getting a break for them, having improved interactions with the family caregiver, because that caregiver and that person taking a break can reduce the stress, can get them both a little bit of time and space away from each other. And for that person to have increased happiness and self-esteem. So how do we plan respite so that those things can happen? And then how do we plan for caregivers to be supported, to be able to take that short break, to be able to plan for that break, even if it's just, I'm going to go to the grocery store, or I'm going to just go for a walk in my neighborhood and breathe. Whatever that looks like, for them to be able to plan to take that break where they can focus on their own self-care, where they can maybe spend time with other family members or their friends, read a book, do everyday things, or just, you've heard the re words a lot today, relax and recharge. And so with that, I'm going to turn it over to Jill to take us into talking about the tools for respite.
Thank you so much, Jane. I'm really glad that we had a chance to hear about these new family perspective tools. It really provides the perfect context for what we're going to be talking about today. And I'm really delighted to be here today to share the LifeCourse tools for respite with everyone. Next slide, please. My name is Jill Kagan, and I'm director of the ARCH National Respite Network and Resource Center. ARCH is primarily funded by the Administration for Community Living to provide training and technical assistance to the Lifespan Respite Care Program grantees and to the respite field generally. For those of you who are unfamiliar with it, the Lifespan Respite Program is a federally funded initiative that helps states build coordinated systems of respite care that support all family caregivers. They also can use funds to train new providers and build respite capacity and provide respite care and support, especially to families who don't qualify for other public funding sources. ARCH also provides information directly to family caregivers through its National Respite Locator Service, two connections to our state respite coalitions, and a few other consumer-focused resources. The National Respite Coalition is our policy division that advocates for respite at the national level. Next slide, please. During today's presentation, we're going to be offering a definition of respite that we use, explaining why it's so important for both family caregiver and family well-being, and Jane has really already talked a little bit about that. And then we're going to talk specifically about how and why the LifeCourse respite tools were developed. We'll provide some real-life examples of the use, the adaptation and benefits of the tools from three of my colleagues, Vonda Reeves with Alabama Lifespan Respite, Cheryl Donnell with the Nevada Lifespan Respite Care Coalition, and Jamie Ayumada with the Nevada Department of Health and Human Services. Next slide, please. I know most of you here are familiar with respite and know what it is, but the term respite is not always understood by caregivers, their families, or even the general public. But ARCH uses this simple, broad, and inclusive definition that's included in the Lifespan Respite Care Act. And that is planned or emergency care provided to a child or adult with special needs in order to provide temporary relief to family caregivers who are caring for that child or adult. So again, even though the person who is being cared for may be the eligible recipient, respite is really a service that is targeted to family caregivers, but can benefit the whole family. Next slide. There are many ways to categorize types of respite, but from the LifeCourse perspective, we can group respite into formal and informal services. Formal most often refers to paid services such as home care agency, group homes, adult daycare services, child care centers, facility-based and community-based programs that are either freestanding nonprofit agencies or those run by organizations such as Easter Seals or the ARC or other disability or aging organizations. Informal services may include respite that caregivers receive from their networks of social and community supports, from family and friends, from volunteers, or from the faith community. Next slide. Sometimes individuals with disabilities rely on family members and friends to continue to live at home and in the community. And Jane talked a lot about how large of a population that probably is. And we know that caregiving can be very rewarding because we want to keep our family members living at home. But it frequently can cause stress, especially if the family is not receiving any supports. Respite is so important because it has been shown to reduce stress among family caregivers, and this in turn can help improve caregiver physical and emotional health. But also by giving that gift of time, respite can help enhance relationships with family and friends and reduce social isolation. And of course, as Jane said, care recipients benefit too, as well from the enhanced family and community interactions that hopefully respite is providing. Next slide. Unfortunately, despite the benefits of respite, too many families are not receiving it. As many as 86% of those caring for adults and maybe as high as 3/4 of parents of children are not getting respite services. We also know that respite, to be most effective, really should be offered as early in the caregiving experience as possible. But so many families wait until they're in a crisis to seek help or to seek respite or seek support. And the reasons for this are many. The barriers to respite have been well documented. Nationally, there are simply not enough public resources dedicated to formal respite services. The system to navigate eligibility can be very confusing and sometimes even overwhelming. Many care recipients and their family caregivers don't even qualify for publicly funded programs. And as a result, the cost of respite may be extremely burdensome, especially if a family caregiver had to give up employment to stay home and provide care. And of course, we saw this really exacerbated during the pandemic. But even when families have the resources to pay for respite, they may not be able to find the providers who are qualified or trained to deal with the unique medical or behavioral needs of the person they care for, or they just can't find the providers or the respite programs at times that they would like to use respite. And of course, all of us have a reluctance to ask for help, or we might be fearful about leaving our family member with someone else. And these can also be significant barriers to getting respite. And of course, just the simple lack of information about how and where to get respite and how to use it most effectively can keep a family from accessing the respite that would be so beneficial. Next slide, please. To help overcome these barriers and help families make the most of their limited respite time, we collaborated with Jane and her colleagues at the LifeCourse Nexus to adapt their Charting the LifeCourse tool specifically for respite. We convened an advisory group of state agency representatives, family caregivers, respite providers to help develop the tools and field test them. The purposes of the tools are to ensure person and family centered respite that provides information on how important respite is. It provides tools for thinking about and planning for respite. And it provides also information about additional resources for finding respite in the community. The tools and how to use them are conveniently included in this wonderful respite guidebook provided for us by the Nexus, and you can see it on the screen. You can find the guidebook and all the tools on the LifeCourse Nexus website, or also right on the Arch website at the link on this slide. Next slide, please. The respite guide and the accompanying tools, including the respite portfolio, an integrated support schedule, and an integrated support star, offer this person and family-centered approach to helping family caregivers who are caring for anyone of any age or disability. Again, our approach is lifespan, to create a plan to access respite services within and outside the formal services system. And I'm just so pleased that my colleagues are here today to share exactly how they use the tools, adapted the tools to facilitate respite for the family caregivers and families that they work with. Next slide, please. And then finally, you know, we have talked about respite and the fact that it's not always being easy to find or arrange for it. And it did get much harder during the pandemic when so many community-based services had to shut down or families were reluctant to use in-home services. The tools really provided some important help during this time, and they could be used to help family caregivers brainstorm how they could get respite on their own or form their community support or family members, or even enhance the respite experience through the use of technology. And our Lifespan Respite Network was with them all the way, and they really jumped in and helped identify or provide adapted or alternative respite that families could use to populate their integrated stars. One way that our grantees were very open to providing support during the pandemic was to modify their respite voucher programs to enhance flexibility in use. And because family caregivers could always use trusted family and friends to provide respite through most state voucher programs, some states even saw an increase in a request for their respite vouchers during the time of the pandemic. Others of our grantees exploded with new creative ideas, developing and sharing alternative supports like Facebook Live education or recreational programs, virtual support groups, weekly phone check-ins, purchasing tablets and internet access, providing drive-by or porch visits. The Alabama Lifespan Respite Program actually used their respite voucher funds to help family caregivers access mental health services. So the definition of respite is forever changed as a result of the pandemic, and we're very excited that many of our grantees are going to continue to provide respite through these new flexible and adapted and alternative approaches. Next slide, please. I'm now going to turn it over to Vonda Reeves with the Alabama Lifespan Respite Network to share how she engages family caregivers in finding and using respite with the LifeCourse tools. So take it away, Vonda.
Thank you, Jill. Good morning, everyone. Again, my name is Vonda Reeves. I'm the training specialist for Alabama Lifespan Respite. I do the training for the south part of the state. And also, I'm also an ambassador for Alabama. And so how I use the Charting the LifeCourse tools is very different. I mostly focus on the person who is providing the care. So each family are asked to have a pack of sticky notes, because before we go into using the tools, I share a story with them because I want them to understand the impact of not having or using family members and or friends to give them a break. So I share a story about one family that I know is very close to a very dear friend of mine. She had a child, had twins, and that child was born with, one of the twins were born with a disability. The other one was fine. So she went through school helping her daughter, and then her oldest daughter ended up getting cancer. She had ovarian cancer. And she's just only 16 years old in high school. So now she has two daughters that she's taking care of. And now she's got a diagnosis that she is sick as well. But while she was taking care of her kids, she had no help. She didn't ask for anyone to help her. So that was a lot of stress that was on her. And each time I give a scenario or mention a disability or whatever, they will have to put a sticky note on them. And by the time we finished, they were covered. So that led us right into using the tools. Next slide, please. So with working with Mr. G said that he also wanted to continue to help with activities of daily living for his wife as well as for himself. He makes sure the medication, the cleaning, and make all the appointments. He does it all. He also, and then for the future, he still has himself doing all of this stuff. As far as relationships, he has his children, his siblings, and his church family. And for the future, he wants to increase increased relationships. And when we get down to the eligibility, he didn't realize that he really qualified for more than what he was getting, because he was using an aide twice a week. He was using a nurse once weekly, and his clergy would come by once a week and provide devotion for them. And so now he wants, for the future, he wants to continue that. He wants to increase his aid and nurses and home health aid, hospice, and respite, what he was eligible for. And as far as the community, he did have a home health aide coming in, a nurse, attend church, and active with his kids. And he also has respite. So he wanted more of that in the future, but he also wanted to be able to spend more time with his grandkids, because his grandkids didn't come around much at all. So what did he have to use with, to stay connected with us with Zoom? Because he attended all of the respite meetings online. He had his cell phone, he had a TV, and he had transportation as well as a computer. But one thing, and for the future, he wanted to use more technology to stay connected with family, friends, and doctors and church services. And one of the things that he didn't even think about that he could have used as for technology was that he could have used a baby monitor to help him with trying to get outside and just do something, just walking around the yard, because he's strictly confined in the home. The home health aides and stuff will come in, but then after they leave, there will be no one. Next slide, please. So as far as his life trajectory, so his past experiences, he was with family, friends, church, doctors, nurses, and technology. And what he wanted, he wanted more respite, and he was willing to accept help. And one of the reasons why he said that he did not want help in the beginning, because he said that he felt ashamed. He was embarrassed because of the how his wife condition had deteriorated, and he didn't want anyone to see her. She has Alzheimer's, and he didn't want anyone to see her at her worst. And he's 70 years old. So another thing that he didn't do in the past, again, not accepting help and not understanding the importance of having someone to give him a break. And a vision that he wanted for him, he wanted his family and friends, and he wanted more respite. He wanted more interaction with his church family. He's now open to having more sitter services come in other than just home health. Accepting more help is his main thing. And he wanted to keep his wife at home as much as possible. His health is now deteriorating as well. And also, Mr. C was another family member that we used the tools with. He just recently, they had no family members around, none whatsoever. They were military and they settled in the town the last time that they were stationed in. So his wife had Alzheimer's, and so he had to end up having emergency surgery, which put him in a bind because he had no one that he could really count on to be with him. So his kids lived up north, so they had to take it, get here. It was like he had a day's notice to get things in place. And so now he's at home, and he realized now that he needs to also ask for more help with his family member, with his wife. Next slide, please. So again, with Mr. G, he, when we did the mapping and the family roles, and he cares about his, his wife, his children, his siblings, and his church family. And looking ahead, who else can make him feel love? His children, and again, his children, And because he kept saying his children, 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 children. And with children, he was also including his grandkids. And he wanted to continue to be able to take care of his wife. He did not want to put her in a nursing home at all. In fact, that's his last resort. And so as far as respiratory care of knowledge, he said he was the only one that knew anything about his wife and who could help with special memories. He said he was the only one that can do that. And even with the lifetime commitment, he said his wife, his children, his siblings, again, who can help him when he needed his children. And provider for day-to-day care, it was only him doing everything for his wife. And even with facilitating inclusion and with membership, it was only him that was doing everything. So with that information, I was able to show him where he was the most constant person providing all of the care for his wife. And therefore, he was at a point where he can experience caregiver burnout. And we wanted to make sure that we keep him from experiencing burnout. So with him having this visual, he was able to see that. So Alabama Family Voices, they provide care notebooks. So I was able to order him a care notebook so he can keep all the information in it about his wife, so that if he's not there, they can use the book to exactly find out what's going on with her, when she takes her medication, what doctors does she see, how was her meal, what were some of her labs, also in case she had to go to the hospital and he wasn't there. We also took this opportunity to talk about what do you do in case of a disaster, like a hurricane or a tornado coming through. So we use these tools also to show him that he really, really needs to plan with everybody in mind. So I'm glad to say that now his children, his two sons, his daughter-in-laws, his sister, and his sister-in-laws are now attending the rest of the meetings that we're having on via Zoom. And now they are also stepping up to the plate to help him. So that's a good thing that came out of this, because they were present. I asked them to invite their family members and they did. And so they was present so that they understood exactly why he needed the help. Next slide, please. Okay, thank you. With Miss Mary, she lived here in Alabama, but she was from Michigan. She had moved here to take care of her mom, and she was still continuing to see about her mother while she's here, and then still trying to take care of herself by seeing her doctors in Michigan. They started refilling her prescriptions and stuff, and they told her that she had to come. She never had anyone to really help her because she was an only child, as well as she only had one child herself, which she lives in North Carolina. So Mary needed to go to Michigan. So she came, I shared with them how to use the schedule. And so she was able to get someone to stay with her mom. She was able to get the same people to stay the entire week that she was gone. And also most of the caregivers now are using the time schedule. I asked them to always keep a running list of things that they would like for someone to do. Once they have that list, they can also fill in the times that they need someone available. And so when someone asks, they can pull out their list and show them what time slot that they have available to help them provide the care. Next slide, please. All right, thank you. That's all I have. Thanks. Any questions? All right, thank you.
We had a couple of questions pop up, but I'm going to save them till the end for now.
All right, thank you.
Thank you, Vonda. That was wonderful.
Thank you, Vonda. Good morning, everybody. My name is Jamie Ahumada, And I will be introducing our Nevada team on this panel presentation today. I work for Nevada Aging and Disability Services Division as a No Wrong Door coordinator in Nevada. Cheryl Donnell is my colleague in Nevada, and she was the program coordinator for the Lifespan Respite Voucher Program and is now serving as the executive director of the Nevada Lifespan Respite Care Coalition. We use the My LifeCourse Respite portfolio in our Respite RX program, and she will be talking about that a little bit more with you in just a moment. Next slide, please. Thank you. I apologize for you. Sorry about that. The Administration for Community Living granted Nevada funding for the Lifespan Respite with the goal of improving the quality and delivery of respite services. ACL has asked, how are grantees integrating person-centered principles into respite programs? So Nevada decided to create a pilot project that was self-directed respite voucher program. We wanted it to be person-centered with person-centered principles to drive the design of the respite for family caregivers statewide. Our thoughts were, I apologize. Our thoughts were to ensure that we answer the following question. What will reflect that we've implemented person-centered philosophies in the design or delivery of respite? And we needed a way to guide caregivers through a self-directed person-centered planning process. The My LifeCourse Respite portfolio tool was selected to meet that need. And the LifeCourse Respite tool will certainly helped us design the respite around the caregiver's needs, and we were able to show the success in using it. Our Respite RX pilot project received over 150 referrals from family caregivers who were not eligible to receive respite services through existing programs, or who needed more flexibility, control, and choice over how the respite services were being provided. We conducted over 100 respite design sessions with participants in our program. It also allowed us to be more culturally competent, tailored services to individuals with diverse populations, and identify what families needed to gain more freedom, support, and connection outside of the caregivers' roles. And then to be truly person-centered, the focus is typically on the one person. However, we found ourselves providing respite programming to two people. One is to the caregiver themselves, and the other one is for their person that they supported or their care recipient. Most respite programming is designed over our care recipients, but we took a different focus and concentrated on the family caregiver. So through using the LifeCourse tool, we had found that the caregiver would tell us about what the caregiver, recipient, or recipients needed in the design of respite. Indeed, family caregivers were more comfortable in talking about the care recipient's needs rather than their own. And then we did not miss many of the details for the care that they needed as far as the care recipients go. And then we also learned that it was just as important to learn what the care recipient's needs were in order to assist and understand how to discuss the needs of a caregiver and the design of their respite needs. And then the slide on the ACL website, it indicates person-centered planning is a process for selecting and organizing the services and supports of an older adult or a person with disability and may need to live in the community. Most important, it is a process that is directed by the person who receives support. Person-centered planning helps the person construct and articulate the vision of future, considered various paths, engage in decision-making and problem-solving, monitor their progress, and make the needed adjustments in a timely manner. It also highlights the individual's responsibility, including taking the appropriate risks. We also took a look at that emergency planning is often a part of that process. The person-centered approach identified the person's strengths, goals, medical needs for the home and community-based services and the desired outcomes. The approach also identify the person's preferences in the areas of recreation, transportation, friendships, therapies and treatments, housing, vocational training. As you can see, there's just a list of that going on. And then the unique factors such as culture and language were also addressed. So through our respite design session, the LifeCourse tool also gave us the opportunity to spend time with each caregiver, convincing them that their own needs were just as important to consider. Caregivers immediately felt that change because no one had really ever asked them about their own needs before. We reminded the caregivers that respite was meant to give them a break, so they could do something that they wanted to do and introduce some coaching around the effective use of this respite program. While doing chores and running errands could certainly get things off of their to-do list, but the question was, would they come back to caregiving feeling refreshed, relaxed, or like they've done something that was meaningful to them? There were benefits of incorporating this respite design session in our program. We really built that great rapport with our caregivers. We were able to get specific details about the care needs. We also knew what resources and connections were available to them. We knew when and where respite could fit into their lives, similar to that schedule outline that Vonda shared with us. And then we really knew what respite would really mean to them as caregivers because we knew what they had selected as an outcome benefit from the break. It also provided good information on the respite worker and provider that would fit their unique need. And we could help the family caregiver outline a strategy to really find and engage what type of respite worker or provider would fit their needs best. So now I will turn it over to Cheryl to discuss how she utilized the tool when she was working with her family caregivers.
All right, well, we only used a couple of pieces of the portfolio, the respite portfolio from the LifeCourse tools. And starting with that star, we discussed what the family caregiver expected to discuss, and that was the care needs of the care recipient. And we like discussing care recipients from their strengths rather than their deficits. And it took some reframing. Caregivers would say things like, oh, they can't do anything for themselves. And then we check and to see if they were able to swallow, get food to their mouth, or use utensils. And then as we carefully reviewed skills related to self-care and mobility, hearing and vision, etc., then we knew exactly what the supports were that were needed. And in discussing relationships on that star, we learned about the natural supports surrounding this family and how close or how far away those supports were. As others have mentioned, sometimes they're not always at hand. Community and the eligibility specific resources are part of that star, showed how well connected this family was and provided the opportunity to explore needs outside of respite. And then in asking about technology, and we could find out about those in use or those that have been abandoned for whatever reason. And it helped to check, help us to check to make sure that needs for assistive technology, either referral or to help understand their barriers in their living situation, so that would help. So then go ahead to the next slide. And so here's a section of that star page that I'm going to just focus on just a little bit. This is the best part of the respite design session, was found in these sections here. And in the what's going on in your life section, we record the typical schedule of the day, meal times, bedtimes, medication schedules, and the activity the caregiver, care recipient engaged in. And then we just transition the conversation and start talking about what a break would look like and when it would fit best in their life schedule. And family caregivers almost universally selected times of the day when the care needs were minimal. That's when they felt they could turn care over to somebody else. And sometimes we'd have to back into that with a discussion when we ask what I consider is the most important question on the form. What would you do with a break from caregiving? And when we knew that they missed having lunch with their friends or wanted a date night with their spouse, we could look at the schedule and suggest a time frame for that kind of break. Would that more likely happen, this time or that time, or on this or that day, weekends or whatever? And if they wanted to take an exercise class, or we could discuss when they would need to have a break so that they could participate, travel time included, and then look at the schedule to determine what the care needs were during that time that a break would need to occur. And that would help to inform us the skills and abilities and availability the respite worker would need to have. And the question about what would they do with a break gave us our program goal for this caregiver and helped determine what was needed to achieve it. So when we discussed who they wanted to spend time with, what activities they wanted to engage in during the break, we could encourage them to do exactly that and address any concerns that would come up with that. And we could then avoid, hopefully, or recognize any previously unacknowledged barriers that we had not yet addressed. And they would tell us what needed to be in place so they could take a break and enjoy the time without worry. And we really wanted to make them think about what would be a more effective use of respite. As Jamie said, cleaning and errands might be needed, but not much joy, relaxation, or rejuvenation would occur. So we wanted them to have something to look forward to and have results that showed they did more for themselves than for others during their respite time. Next slide. So this is on the flip side of the form that we were using the star on. This is the part of the LifeCourse Respite portfolio. We use this side, this trajectory side, as more of a review of how the respite program had worked for the caregivers, because sometimes they had not used respite before, they have an experience. And so before this program, any issues that had come up, like a respite worker asking for money or just not showing up when scheduled, could be reflected on this what didn't work trajectory. And while good things like rapport between the respite worker and the care recipient would land in the what worked well trajectory. And again, this just demonstrated we continue to use a person-centered approach throughout the respite program process. If things were working well, we could check on how the care recipient was feeling about respite. And were there any changes needed? Are the breaks still fitting life? And we could even help caregivers write job descriptions as they recruited their own respite workers from the information that was gathered through this portfolio. These job descriptions gave caregivers something tangible that they could use when talking to others or sharing or posting where they felt comfortable. And not everyone needed a job posting because they knew who they wanted to hire. They were hiring friends or family or had a provider they'd used in the past. But this is what a self-directed, person-centered life course planning tool would help us to identify. Next slide. So what did we learn from our respite program? One of the things we learned was the correlation between what caregivers missed having in their lives and the care burden that they felt was placed on their shoulders. The impact of caregiving on the life of the caregiver shows a more consistent need for respite on an upward trend when caregiving took away more and more time for self, time with family and friends, time for enjoyable activities that would refresh and revive them. The bars on the bottom show the impact of no time for self, no social connections, no help with care, no choice in life activities, and seeing relationships hurt because of caregiving demands. And this was consistent with the longings that were expressed in that respite design session with participants when they were asked those life course questions. What would I do if I had a break from caregiving? And who would I spend time with during a break from caregiving? And helping caregivers see what activities they had discontinued because of caregiving and encouraging them to use respite to restore these activities or find substitutes or alternatives That's the most beneficial purpose of respite, by turning those caregiver motivations for freedom, support, and connection into time spent counteracting some of the negative impacts of caregiving. Next slide. Jamie, I was going to turn it over to you.
I'm sorry, what did you say?
Jamie, you were going to take the next slide.
Oh, sorry, I'm having issues with my mouse. Thank you, Cheryl. So yes, in utilizing the LifeCourse respite portfolio, we had many pieces of our respite picture for each caregiver. We had details on the care and the resources and supports in place, knew how respite would fit and the outcomes expected, and had some kind of idea of the respite worker need and how the family caregiver would go about finding one. And as Cheryl mentioned, we sometimes did job descriptions and postings and kind of help them reach out outside of their natural supports. Our hope has been that we can convince other programs and agencies to use the LifeCourse tool and at least get them to gather common information on family caregivers for reporting and sharing purposes. We have struggled to have the data on family caregivers and specific data points in common across the state. But our efforts have proved successful to having strong person-centered and self-directed underpinning to our Respite RX program, and important data on what is needed for family caregivers to access respite and benefit from it. Next slide, please. And oh, that was the end of it, sorry. So you can always reach out to Cheryl or I with any specific questions about the program or how we utilized the LifeCourse tool by phone or email anytime. Thank you. And we'll go ahead and turn it over to Jill to facilitate any questions for us or for any of the other panelists.
Thank you so much to Jill and Vonda, Jamie, and Cheryl. That was awesome. I'm going to flip to the next slide. I had a couple of questions that I jotted down. Vonda, I had one specifically for you. They want more details on the sticker activity. Can you explain a little bit more about how that works?
Yes. Okay. Usually when I'm doing this, it's in person and we use balloons. So I go through and just do the scenario. I take my time, making sure to tell every part of the story. And as like, okay, she had twins and one was born with a disability, then you get a sticker or you remove the balloon. And then now your second daughter has cancer, then you get a sticker. And now you've been diagnosed with cancer, then you get a sticker or you remove the balloons until you've went through the entire scenario, and then they can see the impact of stress that they're having by not asking for help. It's a visual, because sometimes we don't realize how much stress we're under until you get a visual of exactly what's going on, what's happening. Yeah, that's right. Life.
Sorry, my chat was stuck, so I had to. So somebody had asked for the direct link to the family perspective tools, and I'm going to put a direct link in a minute to the respite tools on our website. So the first link that you just saw there is to the family perspective tools. So Kristen in chat said, have you guys, for the majority, used the family perspective, trajectory, relationships, etc., for when individuals are still living in the natural home? Do you think the tools are also helpful to do with families of people receiving residential supports? 100%. Families are always going to have that information. And so, you're also going to, if they're living in a residential setting, you're also going to get some information from the people that provide care there as well. But I still think you go back to relying on that. If a family is still involved in that person's life and is still around for you to get their perspective, then I think you get it. And Vonda, I saw you shaking your head. Do you want to respond to that as well?
Oh, absolutely. It's best to have the entire team. caregiving is about a team. It's not about just one person, because we also want not only to come to support the person who's providing care, but also for the person who's receiving the care. And as much as possible, they also need to be a part of their care team planning.
Yeah. And the other thing I would add too, you know, especially for someone who's now living outside of their family home, the caregiver, their family caregivers that are no longer providing that care in the home can give you a lot of information about the little things that can be very helpful. I mean, if it's a birthday or Christmas or some other holiday, for instance, if you don't know exactly how that person's used to celebrating that and they're not able to tell you, then if you don't do it right, it may create issues. And so just knowing some of the family traditions and the way the person is used to doing things, like if mom always made an angel food cake for that person and when they were growing up and that was what they always had for their birthday, then maybe you can't make them an angel food cake, but maybe you can go get somebody else to do it for you so that they can have that little bit of home. So I think it's always good to include the family anytime you're planning with the person or trying to find out more about that person and learn about them. It's a great question. So there was another question that came in earlier, and maybe it's already kind of been answered, but someone asked that, you know, what about, you know, people they support maybe don't have family or friends close by. So, and especially what about the aging caregiver that has no other family or doesn't have a support network, especially after the isolation with COVID and everything. What kind of suggestions do you guys have for that, for those families or for those people supporting those families or those caregivers?
This is Jill. I did put some resources in the chat. If your state does have a lifespan program or a state respite coalition, they're a great source of information for supports outside of the formal service system. That's what they're there for, to know about all kinds of options to help you get a respite break. Faith communities are also increasingly getting involved in caregiving issues and caregiving support. And it's worth checking with any local faith communities. And the question was specifically about older parents who are caring for adult children at home, I believe. And I think a lot of people don't realize that their local area agency on aging or their aging and disability resource center, if there is one, administers a program called the National Family Caregiver Support Program. And that program also provides formal and informal supports for that population, a respite and a range of other supports. So even though the area agency on aging might not come to mind immediately for caregiving support, it's definitely worth checking out for support and services. And you can find your local area agency on aging by visiting the eldercarelocator.gov, which is maintained by the Administration for Community Living.
The other thing I would add to that too is, you know, in whatever way you can get that person that's being cared for out of the house, you know, so maybe maybe the caregiver, you know, instead of, a lot of people think about respite, it's like, well, somebody's going to come to my house and they're going to take care of my person while I go out and do something. It doesn't have to be that way. So maybe, you know, if I'm talking about Ben, for instance, you know, maybe I have somebody come, you know, a paid staff, for instance, or, you know, someone that we know. And again, I know you don't have very many, you're talking about people that don't have a lot of connections, but if you can somehow get them to like go to the community center, go to the senior center and have lunch, that's a way that they start making other connections. And so using those times to build the connections, right? To build those people that are like, well, I kind of like hanging out with Ben, you know, I'm going to talk to his mom and, you know, maybe he can come and hang out with me while she takes a little bit of a break, or, you know, and again, you know, if mom's taking a break or the spouse or whoever's the caregiver, you know, if they can plan to do things that will get them connected to other people so that they will have friends and they will have other people maybe that they consider family. So really using those breaks for either one of them. And that's why it's so important to think about not just what the caregiver is going to do during that break, but what is the person who's receiving care doing, and how are we helping them connect to more opportunities, to more people, to building more relationships. Any other questions? That's all I wrote down that I saw popping up. But feel free to either type in chat or go ahead and open up your microphone and talk. I'm going to pull up the direct link to our respite tools now and put that in chat. So give me just a hot second here. And while you're thinking about any questions you might have, let's see, respite. Just going to grab that and dump it in chat. Just give me a second.
While we're waiting for questions, Jane, do you mind just going to the last slide so I can quickly
I
mention?
sure will. There you go.
I have a plug.
You bet.
Before we close out, I just wanted to make sure that all of you knew about our next National Lifespan Respite Conference. It's a chance to come learn more about what's happening in the respite arena. Again, not just from the formal side, but how are we redefining respite in this new post-pandemic world so that it's more meaningful for family caregivers? In fact, the theme for the conference is Reimagine Respite, which is just so relevant right now. And it'll give us a chance to dream about what we really want respite to be, and then all come together to make it happen. And we are, Arch is co-hosting this event with the Respite Care Association of Wisconsin, which is the Lifespan Respite program there. And it will be held in person in Madison, Wisconsin in the middle of September. And I hope you all can join us. So there's more information about the conference on our website.
That's awesome, Jill. Ellen from Oklahoma. Hi, Ellen. Had a comment in chat. She says, during COVID, I think that respite became so difficult that many families just gave up, including us. Recharging the respite discussion is so important. It absolutely is. And so keep talking. And, Jill, when you said having having your dreams about what you want respite to be at your conference, think about that trajectory. What's your dream? What's your vision for respite, and what do you want to make sure doesn't happen? So great questions. And I'm so happy that all of you were here. So coming up, we've got a break for lunch. So go grab your lunch, have something really yummy. And we will be back for another session at 1:30. We have integrating Charting the LifeCourse to meet HCBS requirements for person-centered planning. And my wonderful colleague, Jenny Turner, is going to be leading that. So please tune in at 1:30 p.m. Central Time. And then at 3 o'clock, we have the Innovation in Action, which again is more of a discussion and talking to each other about how you're using the life course and how it works, and having questions for other people about what they're doing. And so I invite all of you, including the presenters that were on today, to jump in and join that session as well. We've had a couple of questions about getting the slides. I'm going to make the slides into a PDF, and I will upload them into the app, and you should be able to access them from the app. If you're having trouble with the app, I'm not the right person to ask those technical questions. I think somebody's working on getting some information out for people that are struggling with that. Again, thank you, everybody. And lots of cool links and things in the chat, so make sure and grab those. And that's all we've got. Any final words from our other presenters? Jump right on in there.